Good evening, everyone. A warm welcome to the Geo Institute Executive Education Masterclass series. This is session 3 of our three-part series. Today's topic is AI for streamlining healthcare administration and operations. We have already completed 2 sessions in the series, and the recordings will be shared with all the participants. I would like to invite today's session moderator, Dr. Kalyan from Geo Institute, to introduce today's distinguished faculty. Over to you, Dr. Kalyan.
Thank you, Mayuri. And thank you, Dr. Avnish, for being here. Dr. Avnish is a clinician turned educator, mentor, advisor, and consultant on AI and emerging technologies in medicine. He's also a consultant for BrainX Cleveland, USA. In addition to that, he is an advisory board chair, Doctors AI Education and Research Foundation, Kolkata, and chief advisor for the ICAIM, the Indian College of AI in Medicine. He's also a very prominent voice in this physical and digital space. I could go on and on about him. He's a man of many talents, but I just want to conclude my brief introduction with one thing. If I had to ask somebody what will AI in healthcare look like in the next decade, the first number I would dial would be that of Dr. Avnish. Pleasure to have you, Dr. Avnish, here. Over to you.
Thank you, Dr. Kalyan. Thank you, Team Geo Institute, for organizing this masterclass series. And I could see that all the three topics are quite relevant and need of the hour. And I'm very happy to be sharing today on the third topic, which is AI for healthcare administration and operations. So before I go ahead, I'll share my screen. So I hope my screen is visible. Okay. Already Dr. Kalyan has introduced me. So I am one of the people who are trying to learn about and educate my fellow professionals, fellow colleagues on the very important topic of AI in medicine. And this is one area which is very close to my heart, which is healthcare administration and operations, because I have done MBA in hospital and health systems management from BITS Pilani. And that is where my entire perspective changed. I started as a medical professional, but then gradually I realized that just talking to patients or just treating them doesn't constitute healthcare. There are a lot of things that go on in the background and to keep the show running. So today we will be talking about some of those things. So just to give you a bit of idea about me for those who don't know me. So I'm a top voice on LinkedIn, which is a platform which I use to amplify the voice of medical professionals in the field of AI. I have been able to do that so far, and I hope I'll be able to do that in future as well. I participated in a few high-profile events like G20 panel discussion when India was the host for G20. This is a photo from AIIMS Rishikesh, and we were discussing the future of healthcare. So it was a very new topic back then, but I think in the last 2 years, a lot of talk has happened around this field, and this masterclass today is also a part of that. And this is the three organizations which I work with. So basically 2 organizations. One is Doctors AI and BrainX, and also my newsletter, which is the MedAI capsule. So I try to be consistent every month. I try to give updates. And for people who have been to New York, maybe you guys have seen this place. So this is Times Square. So I tried my best to mentor medical professionals, and as just to recognize my efforts, they featured me on Times Square. So there also I tried to voice, like, we want to keep medical professionals future ready because we want to enhance healthcare with AI, and without medical professionals being educated and empowered, I don't think that's going to be possible. So thank you again to Geo Institute for taking this initiative and recognizing the need of the hour and organizing such great programs. So these are some disclosures. So I'll be showing you some products or brand names during the course of my presentation. So I hope you'll not take it as an endorsement. It will just be to illustrate the examples so that we understand better. In the next 40 minutes, you can keep typing your questions in Q&A section. And as I ask you some questions, you can put in the chat as well. So the agenda for the next 30-40 minutes will be, we'll be seeing some core challenges because I always like starting my presentation with the why. So once the why is clear and it's out of the way, then what and how becomes very easy. So we'll discuss why we need AI for healthcare administration and operations. Is everything not okay? Can we do better? So all those questions we'll be answering in the first part. Then second, we'll move to use cases and case studies. We'll try to see what is happening out there in the real world. I have tried to keep it contextual to the Indian settings, because as you know, there's a lot of difference between the Western world, how healthcare is administered, and in India, we have our own challenges. So we'll focus more on the Indian context today. Then let us see how we can implement AI. This will answer the how part and what are the preconditions. It's not easy. It's easier said than done. But definitely, if you go in the right direction and in doing the right steps, it has like a lot of benefits to offer, and it's a low-hanging fruit. Healthcare and administration, and you will see why it is so. Then, of course, we have to see the ROI. ROI means return on investment. So everyone out there nowadays is discussing about ROI of healthcare, AI in healthcare. And also in administration, we'll be seeing how we can measure that. And finally, I will leave you with an action plan and vision for the next 30 to 90 days. Maybe many of you are healthcare administrators in the audience. Many of you are in the leadership roles. Or even if you are a medical professional, you can go and you can advocate for change in your setting wherever you are working, and whatever you can do with whatever you can, I think you should get started. And finally, Q&A. So before we get started, so I want you all to answer this in the chat, like how familiar are you with AI in healthcare? So there are 4 options. None of them is right or wrong. You can maybe answer in the chat, so I can get an understanding of what the audience mix is. Or if you're not able to answer in the chat, so maybe you can answer in the Q&A. So I'll come to the mix. So I don't know if chat is enabled, but in the Q&A, okay, I can see. People have read about AI but never used it, and some people are using it in daily practice, which is quite good, especially after generative AI tools. I think the proportion of people using AI daily has increased. And also we have seen that we can see that there are some people who know that AI used in medicine, but they don't understand it well. So you are in the right place. So all of you are in the right place. There's something for everyone. And by the end of the session, I think you all will have some takeaways from this session. So one more question. So what excites you most about AI in healthcare? For those who have answered A and B, like you are either using it or you have a fair bit of understanding. So what excites you the most about AI in healthcare? Why I'm asking this question is because our topic today is a bit out of league. It's not talking about clinical decision support, or it's not talking about AI use in healthcare treatment of diseases and all. So it's a bit different. So I want to know how many of you are excited about especially the option D. Okay, so people are excited about early disease detection, which is a big area. And I think we covered it in CDSS, Clinical Decision Support System, because that helps in early disease detection and treatment. And I can see that people are answering D also. So I'm very happy that people are also interested in the like paraclinical part of healthcare, which is hospital administration and operations. So let's go ahead. I can see the audience is interested, so I'm very happy. Let us start with some core challenges in the healthcare administration, which we usually face. Before I give you the names, just a disclaimer: it's not a comprehensive list, but the most common challenges, which we also as medical professionals many times feel that this. If this could be improved in the healthcare system, then maybe the healthcare system would have been a better place to work. So first is inpatient handover. So I have worked in multiple setups in multiple places, right from OPD to operation theaters to ICUs, and this patient handover is a big, I think many times a pain point. Many times after my night shift of 12 hours, I used to spend around 60 to 90 minutes giving patient handovers. And even after giving that handover, when I used to go to home, I used to feel that maybe I missed out something, or maybe I could have done it in a better way. So this is a big pain point and a core challenge, because what it does is it increases the like time spent by the medical professional inside the hospital setting, and it is a big cause of increasing burnout, because if you're supposed to give handover for 90 minutes due to legacy workflow after your shift, I don't think anyone would like to do that. So this is one big core challenge. It also leads to wait times, increased wait times, which is again considered a waste in healthcare. So if any one of you has done MBA in healthcare or quality management courses, so you will know that a very big chunk of waste in our hospitals is the waiting time. Talking about waiting time, pharmacy processing. So places where they have in-house pharmacies. So I worked in Middle East, and there everything used to be electronic. So the prescription used to be electronic. It used to be transmitted electronically to the pharmacy, and the patient had to collect the medicines from the pharmacy. I'm sure in India also many hospitals are doing this now. Still many are relying on paper prescriptions, where the patient has to take the paper to the pharmacy, and then the pharmacy comes to know that, okay, now we have to fulfill this prescription. And that leads to a lot of processing delays and hampers throughput, which again leads to increased waiting time. So this is again another big challenge, which is very common, especially in the Indian context. Then my dad is a dermatologist, and many times what happens is he consults by appointment. So people take an appointment and they don't turn up, they don't show up. And many times what happens is people take appointment, and then when they come inside the room, they tell, sir, I want to show one more relative of mine. So can you see them? So it takes more time, and then it leads to waiting time for the next patient. So this is because whatever scheduling we are doing right now within the healthcare system is static scheduling. So it cannot adapt dynamically to the demand surges or no shows. So we need some kind of a system where the system is intelligent enough to maybe prioritize or triage, or maybe give some nudges to people who are prone to no show, so that they don't waste the time of the hospital. So all these things can be moved to dynamic scheduling, but this is a big pain point. So I hope you all are getting the gist of what we are discussing, and why we are talking about hospital administration and operations. So everything we talk today will not be relating to diseases and all. It will be relating to administrative issues. And lastly, system fragmentation. I'm sure everyone on this call, someday or the other, has been frustrated by the fragmented systems. Even if they are digital, they are not digital in true sense. So I was working in a hospital, and they were telling me we have a digital EMR. So I told, okay, very nice. So when I saw what they were doing is they were writing a paper prescription, and then they were scanning the prescription and putting it on the Google Drive. So, and they were calling it digital. So I don't think that is the true digital, in a sense, what you want to create, because that is not what we are aiming for, and that leads to a lot of frustrations, a lot of errors, a lot of bottlenecks. So that leads to system fragmentation and increased burnout among the healthcare workers, as well as poor outcomes for the patient. So this all transmits downstream. So these are the core challenges, and that is why we are discussing today this very important topic. And let us see one by one. So what happens nowadays is the same patient is getting to use the services of Blinkit. The same person is getting to use the services of Ola, Uber. The same person is getting to use the services of ticketing companies like ClearTrip and all. And they can see that how speedy, how transparent, how good quality the interaction, the transaction is. And same thing they expect from the healthcare system as well, from our hospitals. But this, I am talking about small hospitals, but this doesn't apply just to small hospitals. Even in big hospitals, in big cities, in metro cities, they face some unique challenges, like there's staff turnover. So there's a lot of hiring, and people keep coming, keep going. So many times there's some festival or something. So there's limited staffing, infrastructure gaps are present, and there's pressure to deliver more with less amount of resources. So this, almost every healthcare system, every hospital in the country, no matter how big a corporate hospital it is, these things are, these challenges exist. And what happens is now AI has come in as a practical solution, which can bridge this kind of expectations with the challenges, and it can provide some kind of practical solution. So you will see a lot of those in the next slides. So I hope it is now very clear that we have some challenges. We are facing a lot of problem. Everything is not good in healthcare. Even if we are giving good treatment, we are having good patient outcomes. Still, the operations and admin part is not so, I would say, fluent or flawless. So operational AI will matter because it will help us in automating a lot of repetitive tasks, which take up a lot of our time and effort. And every day you have to do it, and every day you have to do it from scratch. For example, patient handover, and this will lead to freeing up a lot of clinician and nursing time. So time is money, and if you can free up time, you can free up some ROI also. So this is how it works. And then everything in healthcare boils down to the quality of care, and the biggest, I think, the judge of quality of healthcare is the patient. And if the patient flow, waiting time, patient outcomes all are improved, then uh, the level of satisfaction, the level of quality of healthcare goes up definitely. So that is also where AI will be affecting a lot. Then something called predictive allocation. So suppose I am having a flu season, and I have one physician in my hospital, and there's a flu season coming up, and I know that there will be patients coming in of common cold and all those conditions, but I have no way of forecasting it, no way of predicting it, no objective measure. I have that in my mind that, okay, this season is flu season, this season is dengue season. But then if we have some kind of method or insights using the data where we can do some predictive allocation, we can redistribute the resources, like from an OPD where there's no patient to an OPD where there's a lot of patients. So we can shift our staff and resources. So that can also be done by using AI, and that is why operational AI will matter a lot in the healthcare systems of future. And I think a lot of hospitals are coming up now, which are calling themselves AI powered. So they're already telling that we'll be AI powered. So what does AI powered mean is this operational AI. And this will be working in the background like a brain of the hospital or healthcare system, where it will help in uh, fixing these things right from day one. Not like you are running the hospital and then in between you realize that I need to do these improvements, and then you have to overhaul the entire system. So that's not going to happen in hospitals of future. These things are going to be built in. So if you are opening a hospital, if you are building a hospital, then you have to have some kind of operational AI which is going to help you do these things. And there are already Indian pilot deployments. I'll show you a few. I cannot cover a lot in this 1 hour, but I'll show you a few pilots, and you can then go and search on your own. So you'll be very much convinced that this is quite possible and it is already being done. It's like fiction, or we're talking about the future, it's the present. So 7 practical ways how AI can improve healthcare operations management. These are the 7 ways broadly, and we'll be seeing some use cases from each one of these. So to schedule the providers and equipment effectively, dispatching mobile workers like ambulances. So this intelligent ambulance system, I was reading a research paper in London. They did a study where depending on the voice or the tone of the person who is calling for the ambulance, they were able to triage the emergency level, and then they were able to dispatch the limited number of ambulances in a more efficient manner. Streamlining internal communication, patient communication, a big pain point nowadays, and many of the events of violence, they happen because of bad communication or miscommunication or absent communication. So all those things can also be solved, and we can save our resources and time and effort. Manual administrative work, of course, we have to move to digital first. You can do a limited amount of automation with paper kind of technology, but then I can see a lot of hospitals nowadays get EMR right from the day one. Managing health insurance claims now with schemes like Ayushman Bharat and National Health Authority building a national health insurance exchange. All the processes are going to become digitized, and the more there is AI into the system, the faster you are able to process health insurance claims, and the faster you are able to give service to your patients. And finally, also to recruit employees. Nowadays, a lot of AI is being used. So all these things can be improved by use of some kind of AI or the other, provided you have the data and you have the infrastructure and the intent. Another big problem area for hospitals is this revenue cycle management. So a lot of what happens is you do the work, you provide the service, but then you don't get the money. and money means sustainability. So if you're not able to improve your efficiency in this revenue cycle management area, you will lead to a lot of claim denials and rejections, billing and coding errors. All those things will be keep accumulating, and then in the end, what will happen is your hospital will either shut down or it will not be able to perform efficiently. So this is a very big area and a lot of data intensive. And nowadays everything is digital. So now, RPA, by RPA, we mean robotic process automation. So this is automation. It's not AI, but it's a layer built on top of AI. So you have data and then you build AI on top of it and then you automate the stuff. So this, when you do all this, you can do automatic coding, billing, eligibility verification. You can do reconciliation, billing collections, claim denial management. All these things can be done using intelligent, smart platforms, and you can improve your revenue cycle management and you can improve your efficiency, which will again help you in delivering quality care to the patients. So I think this is enough. Why? And now we are very clear that we have some challenges, and AI can be a part of the solution. It's a puzzle piece, and it can help in a lot of areas in hospital administration and operations. Now we will be seeing use case one by one. We'll be covering a few use cases, 3-4 use cases, which I told you were big pain points, and others also we can discuss, but this is like a 1 hour talk. So if for those of you who don't know, Geo Institute is also coming up with a 2.5-day executive education program where we will be discussing all these things in detail. We'll be seeing some case scenarios. We'll be discussing with the participants on each case for a certain amount of time. There will be some projects which you will be getting during the course. So all these things will come up in more detail in that course. But today we are going to just take a taste of what it is. And I would encourage all of you to keep exploring even after this webinar, like how AI can help in improving hospital administration. So first use case, handoff and documentation or automation. A lot of AI scribes have come out nowadays. Many of you must be using also in your setup for those who have electronic medical records. So now they are adding some features where you can build reports. Like the scribe just takes the language which you speak, it converts it into text, raw text, and then there's some kind of templates or some kind of reports which are built into the system, and then the model like arranges everything, all the information, all relevant information into a report. So shift handover reports can also be created now. Suppose I'm just giving a handover to my colleague in the morning round when they come to do their shift, and I'm from night shift. So I just take them around. I just speak some things. I just tell about every patient. I need not type it into the system. And there's a scribe which is keeping on recording all this. And it will prepare it into a nice shift handover report, summarizing all the medication changes, whatever happened during the night shift. And everything will be available to my colleague who is coming down the line. Similarly for nurses, for doctors, for everyone. In fact, even in the administrative area, if there's a handoff happening, so this kind of thing can be done. Benefits are it reduces the errors, it reduces the delays, so you don't have to stay 90 minutes after your shift to complete all these things. There's very minimal paperwork, it's environment friendly, and it improves continuity and safety in care. So when you are doing a discharge at the end of the care, you need all these things, and all these things have to be pulled out from the system manually many times. And we have the resident doctors, brilliant doctors who are doing this kind of job, sitting in front of a computer when they could have done something better, talking to the patient, working on their communication, but they are busy just making these notes and all. So I think this is one very important use case in hospital administration where we can improve the handoff and documentation. And if you have not explored this yet, as a hospital administrator, as a leader, as a medical professional, as an independent clinic owner, I would urge you to please explore this area. There are a lot of good tools available out there now. We can name many of them, but the purpose is not to overwhelm you with tools, but to help you think in a structured way of what problem you are facing and how you can search for a solution. Another use case, I told you, pharmacy prescription workflow automation. So the patient comes to the OPD, they sit for waiting, they wait outside the doctor's chamber, then they get a prescription which is written on a piece of paper. They go to the pharmacy, then they wait there, and then once they give the paper prescription, sometimes the medicine is not available, or there is some kind of supply chain shortage, or patient has to wait again or come back the other day. So all these kind of problems are there. Even prescription verification, the prescription might be fake. Who knows? Nowadays, anything can happen. So especially with controlled medication. So you have to be very careful. And if you have some kind of e-pharmacy solution or a workflow automation solution with built-in AI, kind of a system which automates prescription verification, it matches it with the previous prescriptions, and it just does a pattern matching, and it gives the order for dispatch and order tracking also beforehand, even when the doctor is just entering the medicine in the system. So right then the order goes to the pharmacy, and it saves a lot of waiting time, and it also helps in a lot of supply chain management, which I will show you in the next slides. So as I said, reduce waiting times and also enhance visibility. So you get to see. So what happens is when you don't record something, so everything is okay. If you're not recording, everything is fine. All the metrics are good. The healthcare quality is excellent. But once you start recording, then you will see how much the patient is waiting. What is the inventory usage? What are the stock outs? Which medicines are always short? What are the demand trends? So all these things will come only when you try to automate or try to build some kind of insights from the data which is being fed into the system. So that kind of layer, when you build in, you will solve a lot of these issues. Then I told you an example of static scheduling and queue management. So there's something called dynamic scheduling, where AI can adjust the doctor staff assignments dynamically based on queue state and priority. Of course, it has to be trained for your particular setup. For maybe you might be a multi-specialty hospital, you might be a single specialty hospital. So you need data. You need data from your past encounters and from a long time period if you are functioning as a hospital from long time. So if you can have that temporal data, you can use it to predict no-shows. So, okay, you know that I've given appointment to this patient, but this patient might not turn up. So there's 90% probability this patient will not turn up. And then what you can do is you can give an extra appointment for that time. So, this all is dynamic. It's happening just like dynamic pricing of the flights. So I got this example because I was booking a flight yesterday, and the prices were changing dynamically, depending on the demand, depending on the availability. So all those things can be applied to healthcare also, of course, in an ethical way. I'm not saying that we should become like airlines and we should take advantage of someone's need of the hour. It's not that, but to make the system more efficient and to fill in no-shows, to waste minimum time, and also to cater to maximum population. So this is one area where you can predict the peak load. Like I told you the example of flu season. So you can predict the flu peak coming up beforehand. You can predict the COVID surge. You can predict the malaria surge, dengue surge. So all these diseases you can predict that you will be getting peak load, so you can reassign the resources. So all this thing can be done, and you will reduce your bottlenecks. So if you know that this season I need more radiographer technicians on duty, this season I need more nursing staff on duty in this particular area. So all these insights will help you in better management of your healthcare system. And one use case is inventory supply forecasting. When you start doing this as an e-pharmacy, then what will happen is you will get a lot of data, and then you can predict also. So depending on the past trends, past prescribing patterns, the shortages, they happen in which season, which month, or from which vendor. So all these things you can incorporate into the system, and you can do some kind of forecasting. So even before there's a surge of demand for some particular medicine, you know it beforehand. Okay, now this surge is going to be there, so I need to be prepared. So you can have some contingency plans. You can avoid stockouts. So this is a very big problem. It happened a lot in COVID, and I was working in Middle East, and I don't remember reusing an N95 mask. I always use one mask for one patient, and we used to discard it. We didn't used to wash it. Some of my colleagues in India, I heard that they used to wash it and use it for multiple times for months altogether. But I never faced this problem, and probably there was some kind of supply forecasting which was happening in the background, which was ensuring that we have enough supply of N95 masks, and they don't run out. So this is something which can be done with the help of AI. And finally, one use case before we take a short 1-minute break, so that we can catch up with what we have learned so far, and maybe Dr. Kalyan can take a few questions and we can have an interaction. So this is one company which was working on vision AI for healthcare. So what happens is a lot of problem in India, especially, is we don't have a lot of digital data in the electronic medical record, but we have CCTV cameras. We have even inside ICUs, even in places where there are monitors, we can see from the camera, we can see the monitor, and we can use some kind of OCR technology to capture the data. There's a company which is doing this for ICU, but this is an example to show you that how you can make your CCTVs of the hospital intelligent, and you'll see some use cases. So safety, security, and operation challenges. So as I told you, sometimes the vitals, you don't get a feed into the system, so you can take from video. You can check whether the staff is there inside the hospital in the correct place. Sometimes what happens is that there's a critical person missing. Sometimes a child is missing. Then where is the wheelchair in the hospital? We just place it somewhere and forget. So all those things, overcrowding. You predict overcrowding before it happens, so that there's less chances of violence. What are the response times? For example, an ambulance is waiting in the ambulance bay. So how long did it take for the staff to attend to the patient in the ambulance? Vehicle monitoring, crowd monitoring, all these kind of things can be done if your CCTVs become smart or intelligent. Otherwise, just seeing from CCTVs, then making 10, 15 people to sit in front of those screens, that is a legacy way of doing it. But I think with the era of AI and vision intelligence, I think we can do things in a better way. So yeah, so before we take any questions, just let me run through this. Okay. So these were the areas which I don't know if this company is still working, but there will be many other companies like this. The purpose is not to show you a company, it is to show you the use cases and to show you what can be done, what is the possibility. Even if you have a CCTV in your hospital, you can get started with some kind of AI for your hospital administration. So what happens is it does vital monitoring, CCTV coverage of the entire hospital for security, response times for ambulance bay, response time of doctors and nurses. So everything is being seen from the cameras, and the administrator is getting a message or a feedback. So whenever there's a guard which is not present, who is not present on the seat, there will be a notification sent after, for example, for 5 minutes, 10 minutes, if the guard is still not there, there will be a notification sent to a central dashboard, and then the administrator can know that, okay, this place is empty, there's no person here. So even before some complications happen, so you can take proactive action. And another thing is that what happens is this is giving real time feedback. So this is one big problem statement. Like they did a case study, like healthcare facility, patient crowding happened. Then it was always followed by unruly behavior from attendants, and then violence happened. So violence doesn't happen immediately. There's some kind of like patterns which are happening before violence happens. So if you're able to detect that and take action in the right time as a hospital administrator, so this is what I was telling you. So this was one of the use cases of this thing. So I think we can take a short 1 minute break in between. So Dr. Kalyan, if we have any questions from the Q&A.
Yeah, thank you for the fantastic presentation so far, Dr. Avnish. There are actually many questions. Some of them I'm getting directly on my WhatsApp. I'll actually put to you two questions, each of which address one end of the spectrum of the size of hospitals. Both of them are from people that I know, and one of them, she's a gynec, and she has a small hospital in a tier 3 city, which has like a 3 specialist OPD and 5 bed. Her question is, A, whether all this is necessary for me in my setup, and B, whether there are existing solutions which are affordable for smaller setups. I'll also put to you the other end of the spectrum question. That also comes from a friend. She's a CHRO at a 300-bed hospital in Telangana. And her question is, how do I choose the right solution? And more importantly, how do I guard myself against snake oil remedies?
Yes. So first, to answer the first question, so nothing is absolutely necessary, but it's always necessary to be aware of the situation scenario which is changing and how you will be able to sustain yourself. So any hospital which is coming up in future, or maybe 5 years from now, they're definitely going to employ these tools from day one. You will have to work in the same environment which is going to be there for those hospitals, and then gradually these technologies are going to creep in. So the earlier you try to adopt these in whatever way you can. I'm not saying you go tomorrow and just buy an expensive AI software which you don't know anything about, and just because someone said snake oil and you buy it. So that should not be done. But then identifying the problems in your workflow. I'm sure and no system is perfect. Even if you're a small hospital, you have your own advantages, you have your own disadvantages. Your workflow might be having some bottlenecks, you might be facing some problems, you might not be collecting data itself in the first place. So I think you can start at a very minimal level, aim for the low hanging fruits, start digitizing, start adopting a good EMR solution, which at least if you don't know what to do with that right now, you just harvest the data and you build a solution later. Because tomorrow, when you decide to build some kind of AI solution, then if you approach a team and they want to build something for you, they will ask for good quality data. So that is for the first question. And second, did I answer the first question completely?
Yeah, absolutely, sir. I think
you will get more
it's
answers as we go on in the second part of the presentation. So I think they will get better answers.
awesome, awesome.
And the second question is, as a part of a hospital of 300 bed hospital, so it's a big hospital. I would always say that the best remedy against such kind of snake oils is knowledge and education. So this masterclass series is a part of that. So you have to understand the technology. See, I'm not telling you that you need to know how to build a microwave to cook food, but you should know how to operate it, what you can cook in it, what you should not cook in it, where it can go wrong, what are the ethical issues. All these things you have to be able to probe the vendor. If a vendor is coming to you with a magical solution, it might be magical. And I'm not saying that there are some very good AI tools out there now and very good use cases. Even hospitals like Mayo Clinic and Cleveland Clinic, they are adopting some very wonderful solutions. And not to go far, even in India, I will show you one case study just after this slide, and you will be very much familiar with that hospital system. So this thing, only knowledge can save you. So I would say take as much information as you can. As a medical professional, don't think that AI is not my cup of tea or mathematics is not my cup of tea. Oh, I don't need to understand, because that is when you will make decisions. Then you will make wrong decisions as an administrator. You will not be able to understand and clearly distinguish snake oil from actual useful tool, because there are useful tools out there and they are very wonderful things which can make hell of a difference to your way of operation of a hospital, and your bottom line and everything can improve. But then you have to be knowledgeable about this, and that is the only way as of now. You can, of course, build a team in your hospital which has expertise in multiple areas, including engineering and all those things you can help you understand. But if you're the decision maker, you need to learn about this technology as much as you can.
I loved what you said about you need not understand how a microwave works, but you need to at least know how to cook to evaluate whether the microwave is doing its job or not. Yeah, that's
Yeah. So that
great
you buy
point.
a good microwave out there. There are different models. So you go and you survey. So you see which function is present. Okay, the how much how much electricity it uses, for example. So all these things you should be able to ask the vendor. So you will be able to only ask confidently and able to understand their answer when you understand the technology and how it works. This is different than internet and Google. It's not internet, right? Should I move on, Dr. Kalyan?
Yeah, absolutely, sir. There are a couple of questions, but I
Yeah.
think as we move ahead in the presentation, some of them might become
Yeah.
clearer.
So some answers you'll get, and otherwise we'll do a Q&A, short Q&A in that. So let us see a few case studies. So I told you the challenges, I told you how AI fits in, I told you what are the use cases. We took a generic view. Now let us see whether it is being done actually. So this is one case study. I've given all the references and I'll be happy to share it with Dr. Kalyan, and he can maybe send it to you, everyone, over an email or something. So this is a case study by Manipal Hospitals, and they tried to improve the nurse handoff and e-pharmacy turnaround timings, which we discussed just a few slides back. And this is the kind of results that they're getting, that they were able to reduce e-pharmacy processing from 15 minutes to less than 5 minutes. Of course, now you might have a kind of argument that Manipal Group is a very big group and they have many hospitals and they have a lot of digital data, they have a lot of human resources. But even if you can replicate this a part of this or some kind of a solution which they took, you can apply it in your own setting. You can have your own success story. And I will show you one more case study, which is of a not so big hospital group. It's from Jaipur, and then these all are available. You can go and study how they did it, what they're doing. These are published papers, publications done. So you can use them as a case study for yourself and your hospital and your use case, and try to see how they did it, what they did. And there are many such case studies. I could not cover all of them, so I have brought 3-4 case studies, but there are many of them out there, and you can try to learn from them also what they're doing. So you learn from your peers. 78% handoff reduction time. This is like really wonderful. If I am a nurse in the hospital, I will love this hospital. There will be no turnover, like staff turnover, because from 90 minutes duration, they were able to bring it to approximate 20 minutes because of using AI to build some automated handoff notes and to improve the process. So 78% reduction is a good, big enough number. So this is something which is like a metrics. These case studies also teach you how to measure those metrics, how to understand whether you improved or not. So these are the metrics which you need to see. It should not be like, हाँ मुझे लग रहा है, I feel we improved. No, nothing by your feeling. Everything should be objective, measured in numbers, and that is how you should take your decisions. 5,000 daily users deployed in 23 of 37 hospitals. So just to show the scale. So it's not on a small scale. They started with a small pilot, but then they gradually built up into this thing. And I'll give you in the implementation roadmap how you should go about it. Of course, I don't have a roadmap for all hospitals across the spectrum, from small clinics to big one, but many of those things apply to all of the setups, and some you might have to customize for yourself. And you can see this is the level of scale which they are operating on and using these AI tools on, and they're doing it on a daily basis. So any one of you, if they are working in Manipal hospitals or they are part of this project, or maybe if you have some kind of similar kind of thing in your own hospital, so I think you can maybe share with all of us. This is another area where a lot of work is happening, which is reducing patient waiting time in outpatient as well as in inpatient. So there have been studies where they were able to significantly reduce the timings by enhancing the processes, by doing predictive analytics, by as I told you, predicting the patient flow, doing dynamic resource allocation. All those things they applied, and they were able to reduce this thing. So this is one real world case study. This is a hospital in Jaipur, DHRC. It's a published case study. You can go and check out this publication. They have done AI enhanced telemedicine, and they have done an advanced queuing model, and they have done cost efficiency analysis. So they have done a very detailed study because many people have questioned around cost efficiency. As I think the second person also asked, or the first person asked the question, how do I adopt these costly systems? So you have to do cost efficiency analysis. You cannot adopt like this in your system. You have to run a small pilot. You have to see whether it is cost effective for my setup. It might work for DHRC, it might not work for you. So you have to do all those things. It's not a plug and play kind of a solution. It's a gradual process, but the end results are very, very good if you do it in a proper way. So as you can see, 40% wait time reduction for emergency cases, and this was 35 to 45% was the range. And they did a cost efficiency analysis with reduced patient costs and better resource usage. So you can go through the entire paper in detail. I cannot cover this in this short webinar, but just to give you a snapshot that this is what is being done and what is being achieved in terms of hospital administration and operations. So I know the journey is like quite long. It's not going to be achieved in a day or two, or even a year, or even a few years. Maybe 5 years, 10 years down the line, we'll be having very good use cases and case studies coming up from even small hospitals in small cities. This is one another area which, if you are a surgeon and you are operating in a high volume setup, so you can maybe use your data and build a predictive model on planned surgical duration accuracy. So the place where I was working in Middle East, the hospital utilization, OT utilization time was a very important metric, and we had to work on it a lot. And if we had some way to predict the planned surgical duration, so the best predictor we had was the anesthetist, and the anesthetist used to consider everything: the surgeon, the patient, the staff, the mood of people in the OT, and then they used to give a prediction in their brain that okay, I should prepare my next patient 10 minutes before this patient gets over. So that was how we are operating, and I think in most parts of India we are doing the same thing. It all depends on the ability of anesthetist to predict how much the duration is going to be and how many cases I can do on the list. So all these things can be now done objectively. If you have kind of data, you can very well predict the duration, wait time, and all those resources you can plan in a better way. So this is possible now. So I'm just trying to give you examples. I'm just trying to put thoughts in your brain to give some food for thought. So after you go from this webinar, you can think about these things, and everything might not apply in your setup. I'm not saying that this is all what you have to do or everything I'm covering and you should go and apply everything. Just maybe try to see one problem for your hospital or your setup and then try to solve it. And once you solve one problem, then you will get confidence to move on to others. Okay, and always go for a pilot. So now let me see what is the biggest barrier to AI adoption in healthcare. This is not a comprehensive list, but if in these four, if I ask you, so if you can mention in the Q&A section, what according to you, so I agree with Duty. So limited AI literacy, and that is what we are trying to address. We want healthcare professionals to lead this AI revolution, not be led by it. So that is the whole idea. Dr. Utso, nice to see you. So cost and infrastructure issues, yes, in a country like India, cost and infrastructure is a big thing, and that is why we have to be very careful in what we pilot, how we pilot. Do we do it the right way? Because if we start something and then we we have a lot of sunken costs, we cannot afford that. B&D, yes. So I agree. All of these are big barriers to adoption, and you might have your own answer, and I have my own, but these all are barriers, and let's see how we can try to address those. So the next few slides which I show you don't apply only to healthcare administration or operations, but it's a general kind of a general idea how to proceed with AI projects, be in any area, even in clinical decision support system or any other area. So what are the preconditions? People ask me, okay, Avnish, I want to do AI. I want to build AI into my hospital system. I want to do some work in AI. I want to make my hospital more efficient. And then when I ask them, sir, how do you collect patient data? So the answer is we do paper prescription. We give it the prescription to the patient. We don't have any record. We scan the prescription, as I told you, and put it on Google Drive. So that is not going to work. You have to be digitally ready to be able to harness the power of AI. That is a precondition. If you don't have an electronic medical record or digital record infrastructure in place, and you don't have access to APIs and these models and all, so it's useless talking about AI. Should not even talk about AI. You should talk first about digital readiness, digital literacy, getting a good proper EMR, which has the latest features, which is interoperable, which can talk to other electronic medical records. So all these things you have to build first. I'm assuming that anyone who is asking question to me in the, I can see a few questions in Q&A that how we can do it, how it can be done. So first precondition is this one. Then second is you have to again have a system which can integrate all your areas like pharmacy, nursing, lab. So you cannot have silos. You cannot have silos operating inside your system in your hospital, that there's a lab system which is talking in a different language. Then you have a nursing system which talks in different language. Then doctors are putting notes in something which is different language. So you cannot have those kind of silos or exceptions. You have to have a system which integrates with each other. It might be modular. It can be modular, but then it has to have a good system integration and interoperability. This is what I want to emphasize. Then you have EMR, you have everything, but then I had a talk with one of my friends in the morning, and we were discussing if we can do a AI project, and it is a very big hospital in India. It's one of the like premier institutes. And when I told him, okay, you must be having a lot of data. So first thing what he mentioned was, Avnish, we cannot trust our data. Because we know the resident doctors are filling the data and they're just getting done with it. They're doing copy paste. So you have to also ensure once you have a good EMR, you have a good system integration, you are also using it correctly. You are training your staff for the data quality, you are making them data literate. What is data hygiene? What is filtering? What is logic? You have to build this kind of literacy from bottom up. This is also a big precondition. And all these things, I'm telling you is because all these things, many of these things are missing. And many of us don't know. We only look for shiny objects. We just run after AI, but we don't know what is the precondition for that AI. We want to get the results or the outcomes which other hospital systems are getting from use of AI, but we are not having an idea that they have already done all this. They have gone through these steps. They have fulfilled these preconditions. That is why today they are able to do all those things which you read in papers and you get amazed that okay, this is also possible. So this all has to be done. There's no shortcut. There is no workaround around these things. And finally, security and privacy, of course. You have to be, from day one, you have to be very much careful. Now there are laws and rules coming around this. So you have to be very careful. Penalties are very huge. And if you have a system which is not secure and not private and not following the standards, so you might be in a problem situation. So all these preconditions are very important. So these slides, these are going to answer to you how. So we saw what are the challenges, like why AI in healthcare administration. Then we saw what with the use cases and all. We saw what is being done, and now how you can do it or how you should proceed about it. As an administrator, your setup might be different. You might work from a small setup or a big setup. So as I told you, this is not like a universal checklist, but then these are the things which you should think about when you're thinking about AI. So you have to audit your workflows. AI is not a Aladdin's Chirag. It's not you tell it to do something, it will do it. There is agentic AI which is coming up, but still you have to decode the workflow. You have to understand. You have to see the patient journey in your hospital, where the patient is entering, how much time the patient is spending at which place, what are the touch points, where is the bottleneck, what happens in this workflow, what happens when a patient of fever comes into my hospital, what happens when a patient of vomiting comes to my hospital, what is the workflow that happens around it. You have to map all those, audit all those, and you have to try to see how you can apply AI, where you can apply AI. But that comes second. First is you have to do workflow audits. So this can also be specialty specific. So if you're in gynecology, workflow will be different. In ENT, workflow will be different. So all these things you have to understand, and you have to first do a workflow audit. Start from here. Then once you have identified a problem, a bottleneck, then again those things come up, like it should be cost efficient, you should have the resources, it should be practical, feasible in your setup. Then you deploy a pilot. You don't deploy a very fancy, expensive AI tool on the entire hospital. You do it in one unit. You catch a low hanging fruit. You see an area which is low risk, and then you apply it there. And then once you are confident that okay, it is giving me some result, then you do a broader deployment. Then partner selection, vendor selection, you have to see whether that person has Indian experience, operating in Indian population, operating in Indian geography. Do they understand the nuances of operating in this geography? So all those things are very important. So someone asked that, how do you understand, how do you figure out which vendor I should buy from, which people I should partner with for AI solutions? So these are some answers to those questions. So then MVP means minimum viable product. So once you have a good pilot, then you develop a product which is like a prototype, and then it is a bit more sophisticated than the pilot, but it is still not the finished product. So you can do some shadow implementation. Maybe the AI can be applied in the background. So, but you don't act on those predictions which AI gives. You only see it. You only assess it. You monitor it. You give feedback. You improve the system with iteration. So that is what you do. And finally, when you have a good MVP, you deploy it across your network. As you saw, Manipal applied it for so many hospitals across this network, and it's only increasing. And also you have to embed governance, compliance, monitoring. So you have to have all these committees in your hospital, like who is going to govern the AI, who is going to build the kind of policies around it. So you have to have that kind of setup also in place. And this completes your implementation roadmap. It's not you buy some AI tool out there, you go and you take off the shelf and you come to your hospital, plug and play. No, it will not work. and it will not work in the long run. You will be very much outdated in a few months of time. So for all those who are being enticed by some very good tools and by some vendors out there who say that tomorrow your hospital picture will change if you apply my AI solution, so please go and ask them these questions. I am not sure if it will apply in my workflow. Have you done some pilots? Have you Indian experience? Do you have Indian experience? What was the feedback during your MVP stage? Ask all these questions. So that is how you are able to get a better solution for your setup, or even you can build your own solution if you are a big enough setup with good data. Then this is one very important area which I would like to emphasize, and I know I'll just check the time. So I'll just finish in 2-3 minutes. So change management and staff engagement is very important. So you have to engage everyone from day one. Whoever is involved in that project, you have to give them training, feedback. You have to make sure that they don't fear AI. That is a very big area which work has to be done on. You have to build the trust in the system, and all this is built when you do in a transparent manner, in the way I told you, as an implementation roadmap. So that is how you build trust in your system. Regulatory, privacy, legal considerations, you have to focus on these areas like data protection, audit trails. You have to keep continuously monitoring the system. If you guys know, Manipal has now started Department of AI, in fact. So that department will be doing all those things like audit trails, deciding access control, working on data protection, and liability responsibility when AI summaries make mistakes. So who is liable, responsible? So you have to have policies around that. So all these things have to be done. And these are the key metrics which you can measure, like time improvement. Have you saved time? Have you reduced errors from the staff? And have you increased patient satisfaction? I think these 3 key metrics should be your North Star when you are applying AI into administration and operations. And these are the risks. So you will face a risk of hallucination. You have to mitigate it. There are mitigation measures also. So you can take a screenshot if you want. These are different risks which you will face once you are applying AI into your hospital administration operations. And there are ways to mitigate it, but you should have the knowledge and you should be able to identify and then work around them. So these are the important risks you need to understand. And for those who talk about ROI, so these are the 2 case studies which we saw in Manipal. There was the definite handoff time reduction, and this freed hundreds of thousands of nurse hours across hospitals. So this was a very tangible ROI. In DHRC model, again, wait times were reduced by 40%, which improved patient satisfaction and lowered patient delay costs. They were able to see more patients in the same amount of time. So this is how you calculate ROI. This is not a universal method or not a foolproof method, but then some way you have to understand, you have to measure the ROI also. It's not going to be easy to take a decision unless you have ROI metrics. By ROI, we mean return on investment. So for the people who ask question, how do you understand if this tool is cost effective? That you do ROI analysis. Then always pilot to scale, ensure all your infrastructure is in place, governance policies are built, and always have a budgeting for IT. I see many hospitals where there's no budget for IT, no budget for like this new technologies. So then again, it's a big problem, because if you don't have a budget, then how you will implement? So you have to fix a budget, just like you fix for marketing and all. You have to fix a budget for IT also, and training also in that. So that is important. And lastly, with an action plan for you for next 30-90 days, if you're a hospital administrator or even a hospital nurse or a doctor, please try to go back to your hospital tomorrow. It's a weekend, so on Monday maybe. So pick 1 or 2 workflows. See how your nurses are doing handoff. See how much time patient is waiting in pharmacy. See how long queues are outside departments, which is the longest queue. So try to understand these. Then try to fix baseline metrics. What is the time taken for a nurse, average time taken for handover? What are the average waiting times of patients in your hospital, for example, in pharmacy? So all those baseline metrics. Then you have to form some kind of engagement with experienced vendor or hospital partner who can build AI system for you, provided you have the data. And then you have to do staff training and pilot it. And once you have succeeded, then you can scale it. But this is a realistic timeline. It doesn't happen in a day, 2 months. It takes some time. So you give that time and you solve one problem at a time. Okay, so this is my vision, and this is the vision which you should also have, a future where administrative workflows run reliably in the background. So any technology is good if it goes in the background. If it is forcing you to be engaged with the technology, and it is requiring you to consistently participate in it, like mobile phones or laptops, I don't think that's a good technology. Technology should always go in the background. Patient handoff should be near instant. Pharmacy should be responsive. Scheduling should be adaptive. Clinician time should be reclaimed, and hospital operations should evolve from reactive to predictive. So this is my vision with which I would leave you. And for those of you who want to get in touch with me, so I'm happy to help you out. So you can reach out to me on this. You can take a screenshot. And with this, I finish my talk, hand it back to the organizers. Thank you.
Thank you, Dr. Avnish. I'm always excited by your talks, and the future looks bright. And on that last point that you mentioned, that technology should be in the background, that made me recollect something. One of my mentors in AI, he often says that technology should be like the alphabet. It should not draw attention to itself. It should directly take you to the meaning. And that's what you said resonated with. We have one interesting question. So the question is that, is there merit for a larger hospital to actually set up its own digital health team? And what does that look like? Or should we just prefer off-the-shelf solutions because they might tend to be more reliable?
So I would say you should do a mix of both. It should not be either or. It should be some kind of a team you should build in your hospital also, which has an understanding of your context, your situation, your patient mix, your problems, and then you should also try to use some off-the-shelf solutions. So it has to be a mix. This is what I want to emphasize. Some people try to build AI from scratch. Like they will say that we will build our entire server here on premise, and then we will only start with that. So I don't think that is also needed. You have to be very strategic in partnering. You have to see what are your complementary strengths. So some hospitals have very good data teams, or they are very proficient in IT. They have been doing it from a long time. So those people taking off the shelf and giving everything, outsourcing it, then that will not be cost efficient, and that will not be able to customize the solution to your area. While on the other hand, if it's a small clinic where you are just looking for a solution, you are the only physician who is working and don't have a team, you don't have time to give to it, then you can start with some off the shelf solutions which have been validated in some setups of your like your setups. If you're a small clinic, then it should be validated in another small clinic setups. So I think that should be the way to go about it.
Makes sense. There is again a rather specific kind of question, which I think would have a no one size will fit all kind of answer. The question is from Dr. Naveen Muppa, and he's asking, what is the desired sample size to get a reliable result or to begin with while building pilot AI models?
So I'm not, just to a disclaimer, I'm not a statistician, and like sample size, the way it works in statistics and the way it works in machine learning is a bit different. It's not exactly the same. Machine learning is more of an iterative process where you start with some kind of, like, if you're building a vision model, so you take around some 100, 500 images, and then you see what kind of accuracy you are getting, and then it's an iterative process. It's not like, okay, if I have a sample size of 30, then I will have a normal distribution, and then I can go forward with AI. So that is why I say a bit of mathematics, like how linear algebra works, what is linear algebra, and then basic things. I don't want to make people afraid on this call and give up AI learning, because I know even I had a fear for maths. But then when I started learning about it, learning how it works in machine learning, I realized that it's very essential to understand the probabilistic nature. So if you read about it, I'm sure this question will be answered in a better way. And I would encourage people who have these kind of questions and will to learn deeper and to delve deeper into this topic, to go for a proper executive program or some kind of a course, so that you get a better understanding that how machine learning is done and how the process works. So that would be my suggestion.
Also, just to add on to what you put together so wonderfully, I think somewhere or the other, sample size is a function of what kind of error are you comfortable with.
Yeah.
So
you have to predefine everything.
You have to predefine the error that you can live with, because and also what kind of compute and time are you willing to devote. So if you are in a situation where you absolutely cannot, like you are looking at a second line testing, like after the screening test where you absolutely cannot live with a false negative, then perhaps you just deploy the highest R square algorithm there, and so on.
But then there's also something called overfitting. So if you
You're
are
right, you're right.
if you are making the algorithm so much deterministic that it will only give that kind of error will be zero, then it will only work on your data set.
That's true.
It will not be able to be generalized.
Generalized to newer data sets.
Yeah, so it's
Fair
a bit
point, fair.
different way of thinking from our normal statistics. So I think we can do it an entire workshop on this, but
I agree.
just to save time, I think this is the way how it works.
Awesome. We have no more questions, but I'm sure that you can expect a lot of messages in your LinkedIn inbox and your Gmail.
For sure.
Thank you, lovely audience.
Yeah. So one last
Sure.
line, if I can. So
Yes.
as I told you in between, Geo Institute has organized a 2.5-day executive program. It is coming up in October. So it is going to be an in-person interaction. So right now we are interacting with the screen, and we are asking you to put your questions in Q&A box, and then we are taking them one by one. But that program is going to be in-person live, where you will be interacting with all the faculties. Like I am one of the resource persons. There are more resource persons who are very much qualified, and they are doing this in real world and applying all these projects and solutions. So if you are really interested and you are living around Mumbai, or if you can travel to Mumbai, so I think Geo Institute is a good place, and they'll be very happy to host any participants who want to learn more. And I think that can be a good starting point for someone who wants to really be serious and get started in this journey. And of course, a credential from Geo Institute is going to definitely give you a foot in the door in times to come. So that's from my side.
Thank you. Thank you so much for the presentation and for your insight and wisdom. And I'm very excited to see you here at Geo Institute. And the invitation is extended to the audience also. Please do check out the program that has been so carefully and lovingly curated for all of you. And hope to see some of you here. Have a great evening, or whichever part of the world you are in. Great rest of the day.
And it has all been done by Dr. Kalyan, and he's the person who has put so much effort behind it, and the Geo Institute team, of course, and they have excellently curated a program which is quite relevant and practical. So hats off to Dr. Kalyan and team.
Thank you, sir. I am tempted to accept all the praise you are giving me, but it would be unfair. I would here definitely add that I am fortunate to have a superb team to guide me always and to, bounce thoughts off and so on. So
very nice.
So most of the credit to Geo Institute team.
Yeah, AI is
a lot of it to our speakers, a little bit to me.
Yeah, someone told me that AI is a team sport. So it's always a team that works, and this is the message which all of our participants should also take.
Yeah, that's a great piece of food for thought. Thank you, sir, once again, and see you everybody. Have a great rest of the day. Bye bye.
Have a nice weekend. Bye.
Bye.